leadership is what this little track is entitled. If people are the most important things in our organization, clearly leadership is what's vitally important to get those people to do what you want them to do. Definition of leadership in my world is getting people to do what they normally wouldn't do. Have a couple of good speakers, good topics about how you get people to do that. I want to introduce Lisa Fuller. She's a director of Six Sigma at St. Francis Medical Center. Her title of the presentation, she actually told me, I asked her, what could I say about you that would get people fired up about listening to you? And she said, no, at the end of the session, we'll see whether they did or not. So I'll just let her go. Ready to go.
Good afternoon, everyone. Well, I'm here I was at all the sessions this morning, and it was really interesting to listen to everyone's journey and how they told their story from where they started to where they are today. So I'm going to do part of that, and as I'm going along, I really want to bring you along as how we have gotten leadership more engaged than they were in the beginning. Although when we started, it was a very top-down approach. So we'll go ahead and I want to take you through a few things. Who we are, we're a flagship hospital of OSF healthcare system. I am from St. Francis Medical Center out of Peoria, Illinois. So we have 8 acute hospitals, we have 616 beds. Average daily census is 481, but oh my goodness, it's been a lot higher lately. We have a lot of off-campus facilities. In the state of Illinois, we do employ our own physicians. We have 750, and you can see presently we have over 200 adjunct faculty. We are connected with UECOM, University of Illinois Medicine. And this talks to our mission, and it's really embracing God's greatest gift. This is interesting to have up here the OSF healthcare system vision, and I'll share with you why. When we started our journey in 2002, we had a more silo approach as far as our system was concerned. Every hospital was doing Six Sigma their own way when we got started and as we went along our journey. We now are within a system and working as a system, and that's brought a lot of benefits that I will share with you. So the burning platform of why we even needed to go here is really achieving near perfection. We have a lot of other pressures coming down on us that really built into that burning platform, such as healthcare reform. We are one of the ACO pioneer groups, so that's adding to the complexity of what we do each and every day. So why PI or why Lean Six Sigma? It provides a framework. It's a common language we can all speak. We can share to where we're going. We can share how we want to get there. And we can all, really a lot of it goes back to that common language and being able to share those concepts. It really builds upon our sister's mission and vision. And one of our mottos is it's every patient, every time. And this allows us to do that. So let's look at our PI journey. We started, and earlier today someone talked about TQM, CQI. We did those in the 80s. We really launched our Six Sigma efforts in 2002. It was the same time Caterpillar Incorporated launched their Six Sigma. We are in the same town as their corporate headquarters and a lot of Caterpillar's production. And we went through this together. We had 2 waves of belts that were trained really using manufacturing education. So they had to learn the manufacturing, and then all the examples were manufacturing, and they had to come back and kind of change that into their mind to transactional. We actually purchased the ability to license and teach, so we now train internally, and all those examples are now healthcare, so we can follow them, and it makes a lot more sense. But I often feel for some of those early black belts that had to go through that and then make that change in their heads. As you can see, St. Francis Medical Center was the first to deploy. Shortly thereafter, health plans came along, home health came along, and as you look at the continuum, the other facilities kind of came into play. The director at that time, my predecessor, she really helped coordinate the deployments at all our facilities. There were 7 at the time. We now have 8. But some of the other things I want to call out here, in the red you'll notice at the end of 2006, and we're going to talk about this today, is we deployed a strategic PI model. Because we were noticing after 4 years of doing this that we really needed to find a better way of getting PI from the boardroom down to the bedside, and how do we make an impact, and how do we involve all staff, all managers, all directors, so that they can apply some of these skills to what they're doing each and every day. Another thing I'd like to call out, towards the end of 2008, and this is about when I came on board, so I think I had the position for 3 weeks when I had to present to the entire organization Lean. So luckily, the person that was leaving, we partnered together, and we had an introduction to Lean. We didn't get the ground started that we wanted to when we deployed Lean, and part of that was there was a lot of turnover in the department. We lost 4 master black belts. The executive director went over to strategic planning. So with all that came a lot of change. So yes, we've done Six Sigma. Yes, we've done Lean. We want to get further into the Lean journey, although there was an understanding that, wow, we have all this, but we're not doing as many Lean projects as what we wanted to do. So we do a combination of both of them. It's a hybrid. So we're pulling out tools that we need that are adaptable. And it's not doing every tool with every project. It's looking at each project individually and determining what is it that we need to use to get the best results and have the greatest success. The other thing I want to pull out of here is you'll see at the beginning of 2009, our Corporate Performance Improvement Division was created. It really took them to the middle of 2010 till we started to see a lot more infrastructure around